Well, hello everyone. Welcome to Rainmaker's Roundup. I'm your host, Mark Iorio, and I've got a good friend of mine with me today, Dave Navazio. David is the CEO of Gentel in
Good morning,
Bristol,
Mark.
PA. How are you, David?
Really well, thank you.
Welcome to the show.
Thank you.
You're welcome.
Great to be back on the show.
Yeah, you've been here before, right? And
Correct.
we had a great chat a couple years ago, and you're back. So, lots going on at Gentel, right?
A lot going on.
Yeah. Tell us about what's going on, and then I want to kind of take the audience through, how you've grown this business.
Sure, my pleasure. We continue to service nursing homes with our total wound care solution. And currently, we're servicing about 26 nursing homes across the country, and we supply certified wound clinicians that come in and help with education, because in what we do in wound care, it's not just about products, it's also about understanding the dynamics of wound care and using the appropriate product based on the characteristics of the wound.
So the growth and what you've done over the last couple of years, especially given what's happened, David, with COVID, how's that gone?
Well, certainly, every business, COVID, really certainly changed the dynamics. And, for us, it was particularly interesting because nursing homes is considered ground zero of the pandemic.
Sure.
And I'll tell you, that was probably when I was most proud of Gentel and, my team and everybody involved in Gentel. Can I talk a little bit about what we did during the pandemic?
Absolutely, sure.
So, and I'll never forget, right when the governor shut everything down in Pennsylvania except for essential businesses, and that was, that Sunday. I mean, I reached out to my, executive team leaders, and we had a call, and we said, hey, we got to figure this out because, we service patients in nursing homes, and number one, we've got to get in there because treatments have to continue. We've got to figure out how we can stay operational just from a business perspective, like many companies. We've got to make sure that we can get our employees into the office to be able to, do the work that we need to do.
Yep.
So, everybody took their tasks, and that Monday, we got approval from the state to be in the office as an essential business. But, being an essential business, you still have employees that, really are scared. They don't know what's going on.
Yeah, exactly,
so,
sure.
We had to really, put out some communication that giving them, a lot of information on COVID. We had to make sure that our building was as safe as possible for those employees. For those that came in, we provided lunch. So, when we shut off the lunchroom, we allowed them to eat their lunch at their desks. We, social distance where we could have people working remotely. We did. So we took a, whole lot of steps, and it wasn't just me. I mean, it was all of the leaders, all of the managers, all of the regional managers across the country, because we've got, clinicians. We got to keep them safe. We got to make arrangements for getting them back into the building. Government said, you can't have any visits in nursing homes, but they forgot that, there are providers coming in that are, rendering important treatments to patients. So we had to get a work around that. We had to make sure our clinicians were safe. We had to get them tested. And then we had to convince the customer, that we were going to be part of a solution and not, be another burden or another problem to them. So all of that happened, and all of that happened quickly. And, from a business perspective, we had very little disruption in revenue. From a customer satisfaction, we really came across that, we were sympathetic to the issue, but we were also smart enough to put together an effective plan to be able to render the service to the patients.
Yeah. That's good leadership. That's not just leadership from you, but leadership from the entire management team, and you got to be proud of the way that was handled.
Oh, absolutely. I have an amazing team, and that just doesn't happen. I mean, I think when we talked about the beginning days and the last time and the beginning struggles, until a company gets at a certain level and you're really able to attract good talent, because, some people, good people, also want to work for, an organization that they believe in, but an organization that they feel is also growing.
Yeah.
So, that's probably what happens in the second phase of a business.
Yeah. No, I mean, your early stages when you first started Gentel, you did go through that, and when we were on the set the last time. But I find that story, the way in which you started the business and grew the business fascinating. So if you just kind of tell the audience a little bit more about that, that would be cool, because we're friends.
Sure.
We're fellow Rotarians. But I'm proud of what you've done and what you've accomplished. And it's a great story, David, because a lot of times entrepreneurs kind of, they see some of these obstacles in front of them and they give up or they give in. You never did.
You know what? No. Because the one thing was I believed in, what we were doing. And, like most businesses in the beginning days, you're underfunded, you don't have enough customers, you don't have enough employees, and it becomes a huge struggle. But, you have to keep at it, and I just kept at it. It took a lot longer, than I wanted it to. But it happened. I mean, you have to stay focused. You have to just never ever, lose sight on, what you're trying to accomplish. Never lose sight on that, the end game. But you also have to really believe in what you're doing. You have to make sure that there is a market for what you're doing, and there's a need, and that you're satisfying something.
Yeah. Well, and you did. And the nice thing about it too is that when you look at your operations, what you've done is you buttoned up the operations so that you're providing a quality product, right? So
Sure.
all the operational side had to be in place so that when you go out and sell the product, you can have the people who are selling the product feel confident that the people behind you are doing what they're supposed to be doing from
Absolutely.
a quality control standpoint.
Yeah, absolutely. You can always start out where you're outsourcing some functions, but the ultimate goal is to control it all, because when you control it all, then you have, really a total say on, the ultimate product, the quality, and the branding and everything. And I think that's important. The great thing about Gentel is, we're a products company, we're a manufacturer, we're a service provider, and the brand continuity transcends over, the whole sphere of the business, and that's, really
That is
a
cool.
great thing to have.
And it's kind of unique too, it really is, because if you would just explain to the audience what you meant by that. You're a manufacturer, you're a distributor, and you're a service provider. Talk about that, because I think that's kind of a unique business model.
Well, in our business, it is, and we're a healthcare business, and we're a healthcare provider, and we're, providing products, and we're billing insurance companies, or we're billing customer facilities.
Yeah.
And the great thing is we also produce the products, we manufacture the products. The products have our name, so you have the name through everything that you're doing, all of the programming, the education, and the work. So it's really a good good concept. And the other thing that it does is it really lends some great credibility in what you're doing. I mean, your name's on the product, and your name is all over. Every nursing home that we service, certainly knows our name.
Knows the Gentel name. Yeah.
Sure.
How did you what was the impetus behind you getting into the wound care business? What was that like for you?
A lot of people in healthcare, we start out in medical equipment companies, home care equipment companies, home care, and that's where I started. And then at some point, started working with nursing homes, and I really fell in love with nursing homes. I just, thought that was just really a great need, and I fell in love with wound care. So wound care and nursing homes was such a perfect fit, and really that's all we do.
Yeah. Why do you have such a passion for doing what you do? Where does that all come from? What's the, when your feet hit the floor in the morning, And I'm talking about the passion for the work that you do and the people that surround you and how you help your end users, your customers, your patients.
Well, if you figure, an average nursing home is probably going to have maybe 15 patients with wounds. We're servicing, 2,500, 2,600 nursing homes across the country. It's
Wow.
a lot of patients
It is.
every single day, with wounds, with chronic wounds. And, it gives me a great feeling that we are able, to help those patients heal those wounds. And I know we do it, and I know there's nobody that does it as well as we do it.
Yeah.
As we have, top clinicians, we have top programs, and we've got great products. So every single day, thousands of patients are better off because Gentel exists and the people that are behind Gentel
That's
are
great.
doing what we do. And there are not that many businesses where you can have that kind of passion.
Yeah. And I'm sure you have tons of case studies where patients have gotten better as a result of the products, the service.
Oh, absolutely.
Right.
We've developed a wound documentation system. So, we document all of the wounds because we do that. We want to make sure that, the wound, the characteristics of the wound are being treated appropriately. Wound care doesn't have to be expensive. It needs to be efficient. It needs to be economical. And the wound characteristics have to dictate the treatment. So what we do is we make it easier for that to occur.
Yeah.
But we're talking about, we can look at data probably of well over 1 million wounds.
Wow.
And what we can see is facilities that use Gentel, after a period, their wound healing rate starts declining, and that's a good thing. That means that they've got a good wound care program in their facility, and we're seeing a good, improvement in, the amount of time it's taking to heal wounds. And that's because of many different, things occurring. That's nutrition, that's patient handling, support surfaces, and wound care products. So it's not just one thing, it's
Yeah.
education. And they're all the things that we really help with.
Yeah. As you see the expansion of Gentel, and you said there's 2,700 nursing facilities around the United States, and about 15 or so patients within each nursing home that has that dealing with wounds.
Right.
How do you grow that business? What's the growth pattern there, David?
Well, each month we're probably picking up, I would say, maybe 50 new customers and losing very few.
Yeah.
So each month we see consistent growth. It's more people feeling comfortable, people leaving, nursing homes, going to work for other nursing homes, having a good experience, recommending you to come in. So it's really all different things. And, again, people knowing the Gentel name and feeling good and having I always say, once, if we don't do a good job, it's over. We have to do a good job every single day. We have to make sure that, we are, doing a good job and exceeding the expectations.
I love it. I love it. We're going to have to take a quick commercial
Sure.
break. When we come back, we'll talk to you more about the Gentel and some of the things that you're currently doing and how you're expanding the business. We'll be right back after this message from our sponsors. Don't go away.
My gifts are from The RealReal because I always feel very confident in what I get. I know it's been authenticated. The thrill of the hunt. They have things I never thought I'd see again.
Gonna relish the gifts and the smiles.
Top designers, up to 90% off retail. All I want for Christmas is Gucci, Louis Vuitton, Hermes, Prada, Rolex, Cartier.
Real stuff at a really good price.
Unwrap the unexpected with The RealReal.
Shop over 10,000 new arrivals daily. Get 20% off at The RealReal. Terms apply.
More than 200,000 people in the U.S. who have died from COVID-19. Hundreds more die every day, still an alarming rate of loss.
Masks matter. These masks, they matter. It matters, it saves lives, it prevents the spread of the disease.
sure you're up to host?
Yeah. We want to keep it the way it always was, right? That's your grandma. She was the best at the holidays.
Welcome back to Rainmaker's Roundup. I'm your host, Mark Iorio, and I'm with David Navazio. David is the CEO of Gentel in Bristol, Pennsylvania, wound care service and products company. Great to have you on the show.
Thank you.
You're welcome.
Thank
Doing
you.
great. I love this. David, in terms of, before the break, I was talking a little bit about the growth of Gentel. How do you find new clients? And a lot of it, new clients, a lot of it is word of mouth, right? And it's a service, right, along with the products. So take us through kind of the sales and marketing process and how you continue to expand, not just with reputation and word of mouth, but
Sure.
otherwise.
Sure. My pleasure.
Yeah.
You know, there are two types of nursing homes, the ones that we service and the ones that we don't. So the ones that we service, well, we know what we have to do there. We have to keep them happy. The ones that we're not servicing, we have to, look and we have to determine, who operates them, who owns them, who do we need to reach out to so we can have an opportunity to present our services, our products, the Gentel Total Wound Care Solution. Like any other business, and we'll work with leads. We, try to get, develop a contact person. We try to reach out to them, and the most important thing we want to do is an opportunity to present the services.
Yeah.
And based on who we're presenting, if it's an operator and we're a purchasing manager and we're going to talk more business, then that's one type of a presentation. But if they're inviting their clinical people, then, we want to certainly bring our, clinical leader in and talk more about the clinical advantages of using Gentel.
And what sort of differentiation do you see and do you offer up to either a purchasing agent or a clinician to say, the Gentel wound care process, our system, is much different than, our competitors, and this is why?
Well, the main difference is because we're a manufacturer. So that means that we're able to offer what we call a Gentel Equal Care program, which is sort of an insurance policy for the non-insurance compensable wound care patients.
Okay.
So now a customer has a wound care program that transcends over their entire wound care population, regardless of how they're insured. So, and that's important because now you've got a good continuity of care.
Yeah.
Our competitors come in, they say, well, we're here to help with your wound care, but we're only really able to help with your wound care that have, insurance.
Exactly. Yeah.
So, we're able to take that entire population.
Yeah. So it's much broader and more comprehensive.
More comprehensive, for sure.
Yeah. David, so sitting here, thinking about what you've done over your career and looking at how Gentel has grown and how you've grown as a leader, how you've grown as a business person, what are the things that you would have done maybe differently if you had to do it all over again?
I think if I had to do it all over again, I would make sure that I had, I was better capitalized. I would have made sure that there was, good funding in place. The problem is, in a new business, it's, hard to get money, hard to borrow money, hard to raise money. And then when you really need it, it's too late because, you don't have any money and your credit's no good. So, it takes a while. But I think I would have probably spent more time on the financial aspect of the business, rather than, all of the other elements. So, my recommendation to anybody is, really, think that through. Think the money that you need for your business and how you can get it and talk to people and reach out to people because, you'll be surprised with some of the ideas that you get.
Oh, yeah.
You know, and the other thing is and you know, I think we've talked about this before, is get with groups of other business people and share ideas, because you'll find that, you know, where you are in your business model, you know, there's a similarity in the same struggles and the same issues that, you know, every business, regardless of what kind of business you're in, faces.
Yeah. The finance opportunity is really interesting because you're right. When you need the money, the banks are not there.
No, for sure. And you know, that American Express, they're not necessarily your partner.
No, not at all. But when you don't need the money, the banks show up. They seem to knock on your door. No, I'm good. I don't need any financing now. I needed you 10 years ago or 15 years ago.
For sure. So. Yeah. Now we're great friends.
Right. Exactly. So let's harken back to the younger David Navazio, right? Younger person coming into the business. What advice would you give to a younger person, whether it was a younger you or a person getting into the business that Gentel is in, or maybe even any business?
Well, a business that Gentel is in, the key is you have to understand healthcare, and you have to understand the regulatory environment, you know, of healthcare. It's not, you know, hey, this makes sense, this makes good business sense. There's a regulatory environment that is crucial to understand. Other businesses, you know, don't have to worry so much about, you know, the regulatory requirements. And with Gentel, I mean, we've got, you know, we have to worry about the FDA because we're a manufacturer. We have to worry about the healthcare, you know, regulations that, you know, that are there. So, and a lot of them, you know, you got to give it a lot of attention. But I would tell somebody that, first off, make sure there's a market. You know, make sure there's a market for what you want. Make sure that you've got passion for it. Make sure you're willing, you know, to work. Don't get into business with yourself because you want flexibility or you want more time home. And, you know, if you're married, you know, make sure your spouse is in agreement with you.
Right.
Because it is a family commitment, and it is a family, you know, participates, and the, you know, family does without you at certain times. So, you know, you have to make sure it's not for everybody.
Yeah.
But when it works, there's nothing like it.
Yeah, absolutely. I mean, entrepreneurs, you know, being an entrepreneur is not for the faint of heart.
It's not for the faint of heart.
Right.
But you know what, you know, it said, like, you know, but I mean, I don't know. Am I an entrepreneur? I mean, I've been basically doing the same thing for, you know, 30 years. Is that, or 25 years? Is that an entrepreneur? I always think an entrepreneur is going to, you know, get a good idea, you know, work with it, and then, you know, maybe sell it off and start something new. But when you do the same thing for so many years, I don't know. Not such a good
You're a business owner.
I
don't know what the difference is between a great business owner and an entrepreneur. I guess there's serial entrepreneurs out there who start things because they have great ideas. But you know, you had a great idea with Gentel, and you've grown it, and you know, you're here today because of that growth, right? And
thank you.
You're welcome. So. Thinking back, you've had family in the business, right? Your dad was part of it at one point. You got a great wife and a great daughter, and so when I look back, I look at you and I think to myself, well, who inspires you? Where do you find inspiration day by day, David?
Well, you know, my father was a really, you know, was really a great inspiration. And I mean, he told me a couple of things that always resonated with me. One thing he told me was, he says, Day, because my family abbreviates all our names.
Everything.
So David becomes Day. He says, you know, Day, look like you own the joint.
Yeah.
You know, look like you belong. And, you know, that, you know, really resonated with me. And then another great story he told me was when he was in basic training for World War II. And they had to do the parachuting. And he was up on the plane, and he was petrified. And the guy, like, you know, two two ahead of him, broke down and cried and said, I can't do this, I can't do it. And the sergeant there put his hand on the guy and says, don't worry. If you can't do it, you don't need to do it. And my father got a relief. He says, great, I'll do the same thing because I don't want to do it. Then the sergeant gets his foot and kicks the guy out the plane. And my father realized he was going. There was nothing you can do.
Right.
And if he was going to go, at least he was going to look okay.
Right, exactly.
And I realize there's sometimes that you've got no choice. You may want to run, you can't run, and you just have to look right.
Yeah.
It's all about leadership.
It is. It is.
People look at, focus on the leader and how the leader responds to situations. And I think that's, really cruel for anybody. But the other inspiration is movies. I mean, every businessman, don't we look at other people's money with Danny DeVito, especially when he talks about the buggy whip?
Right.
Okay? But there's another movie, Mark, Vertical Impact. This rock climbing family.
Yeah.
The dad is on the bottom, the son and the daughter's on the top, and the rope is giving way. And the father's telling the son, cut the rope right below the son, which means the father would drop to his death.
Yeah.
And the son saying, can't do it. And the father says, if you don't do it, we're all going to die.
Yeah.
At least do it for your sister.
Yeah.
So he cuts it and the father dies.
Wow.
You know what? Decisions aren't always easy.
Yeah.
Okay? Decisions and that's all about making decisions. You got to make decisions, and you have to make decisions. And some decisions, affect other people, affect lives, but they have to be made because that's what a leader does.
Absolutely.
A leader makes decisions. I tell my daughter all the time, when she was a little kid, just make decisions. The more decisions you make, then the easier it becomes.
Yeah. And they don't always have to be right, and they're not always
And they're not always right.
Not always right.
Right.
It's been an absolute pleasure, my friend. It was
Thank you, Mark.
very comfortable and relaxed, and I love having you here.
Great,
David,
thank
if you can look at that camera right over there and tell us how to get in touch with your awesome company.
Sure. Gentel, and we actually have offices in Boca, in Nashville, in Chicago, and our main office is in Bristol, and you can reach us at telephone number 215-788-2700 or at www.gentel.com.
Great. And they're also on LinkedIn, and they have YouTube channels and everything else. And I'm sure this interview is going to get on their website. I'm positive that's going to happen. Thanks for joining us.
Thank
You're
you.
welcome.
This is great.
You're welcome. All right, ladies and gentlemen, that's a wrap for Rainmaker's Roundup. Have a wonderful and safe week, everyone. We'll see you next time.